All right, tell me if I'm wrong here, but I've heard a lot of people, including myself, say that they felt a special bond with their pediatrician. They all remember their pediatrician and have these memories. And when they think of their doctor, that's who they think of. But they didn't quite develop that bond relationship with their adult doctor. And it's always perplexed me because I'm like, pediatricians only see kids, up through about 21 years old or so. Then the rest of their life, which could be anywhere from 30 to 60 years, is, seeing an adult doctor. So you would think that most people would have a lot of fond memories of their adult doctor, not just their pediatrician. But that doesn't seem to be the case. And when I thought about this, I came to a realization. So when you actually count the number of well visits pediatricians do, we don't just see a child annually, at least not when they're younger. When you're an adult, you go to your internal medicine or family doctor once a year, usually for a routine checkup, maybe a sick visit here or there. But in pediatrics, those first few years, we were seeing a child, every month, every 2 months, every 3 months, like very frequently. And then we only switch to annual visits after they turn 3 years old. And in between, we have many sick visits because kids just get sick more often than adults. They're touching stuff, their immune systems aren't the best, they're getting exposed to things. If you've had a child in daycare, you know this. They're constantly getting sick, constantly going to the doctor. So there's a ton of visits packed into those first 21 years of life for a pediatrician. On top of that, we are bonding with the child and the family. When you're an adult patient, it's just you and the doctor. But usually the pediatrician knows the child, knows their siblings, knows their mom and dad. And so the whole family is involved in the care. And you're also there for the child's life in their most formative years when they're, developing as a toddler, when they are growing into adulthood and adolescence. There are so many milestones and parts of a child's life that you get to be a part of as a pediatrician. So as a result of all of that, I feel that's why many of us feel like, when we think about our doctor, we think about our pediatrician, and we feel like we had a really special and nice relationship with our pediatrician that is quite honestly and sadly hard to find in adult medicine these days. That's not to say there's anything wrong with adult medicine. Honestly, I kind of wish I did it sometimes because the pay is better and you have some great experiences there too. But I do feel like what I just described is something very unique to pediatrics, and despite all the problems in the field right now, that is one of the cool things about it that still keeps me showing up every day.